Yeah, good morning all. So, to the continuation of the drug chemistry. So today we are going to discuss about the drugs acting on cell wall and cell membrane here. Yes, is it audible, ma?
Yes, sir. Audible, sir. Good
Yeah,
morning,
fine.
sir.
Yeah, fine. Okay, right. Okay. So here the drugs acting on cell walls and cell membrane here. So we know that what is the cell wall and what is the cell membrane here. So generally in the right the cell. Okay. So in the living organism, generally all the living organism, either it is plants or the animals. So the living organism, it is made up of the smallest unit called the cell here. Okay. And generally the cell is a what is the primary unit, right? Cell is a primary unit here, and we know the structure and the functions of the cell here. So generally this cell is having so many cell organelles. Okay, cell organelles, and the what is its pharmaco means pharmacology, right? So like you see, the cell is in the, if we observe the cell structure here, right? So you can see the cell wall, and inside you can see the cell membrane here, and in the center of that cell you can see the nucleus. Okay, and that is the cell. It is composed with the cell organelles like mitochondria, Golgi complex. Okay, like that. And in the nucleus you can see the nucleic acids like DNA and RNA. Okay, so all these are the structure of the cell here. Okay, and in the cell, if you take the cell here, cell wall is a very important material which is covered this cell here. Okay, it is a outside wall here. Cell wall is a the outside wall, and all the cell organelles and the nucleus will be protected by your cell wall, right? So due to this cell wall, so you see, means like any what is it, means pathogens are the viruses or the bacteria, whatever which is entered in the body, so it cannot be damage cell here due to having the cell wall. So the cell wall is a protection for the cell here. Okay, and the cell membrane, so cell membrane, it is a thin layer, right? It is present inside the cell here. Okay, so these are the cell wall and cell membrane. These are the outside material which is protecting your cell here. Okay, and here in the drug chemistry, you see few of the drugs, right? Some category of the drugs, they will targets the cell wall and the cell membrane here, and they will damage and they will destroy the cell wall and cell membrane of the pathogen, right? In order to kill the particular pathogens like bacteria, virus, or the fungus, whatever. Okay, so means the drugs which are taken in the drug means disease condition, right? So the drugs will be targets the cell wall and cell membrane, and they will destroy the cell walls. So once the cell wall is destroyed, then what will happen here? There is no meaning of the cell, isn't it? Because all the cell organelles and the nucleus will be gets damaged, because there is no protection of the outer layer here, because it is consumed or it is damaged or destroyed by the drug. So ultimately the particular what is that pathogen is going to die, right? So that is a concept of the drug mechanism which is acting on the cell wall and the cell membrane here, isn't it? Right. Now you see here the bacterial cell walls, right? So because here the generally these category drugs are the antibacterial drugs here, right? Antibiotics, right? Antibiotics, these are most of the uh, means drugs which is targeting the cell walls and cell membranes, are the antibiotics only. uh, Here you see the bacteria. We know the structure of the bacteria. Means biology people will know the structure of the bacteria cell wall here, and we have the idea that, right. So means the biology people are very familiar with the bacterial cell walls. Generally, bacteria are two types: gram positive bacteria and gram negative bacteria, isn't it? They have the idea about that bacterial type of bacteria here, right? So here the gram negative and gram positive bacteria, generally structurally they will differ, right? The structurally they will differ. Both are the pathogens only, both are the bacteria only, but only the structural features are different here, right? You can see the structural features of the bacteria will be differs here, right? Means like a cell wall, where you see the gram negative is having very complex structure of the cell wall, and gram positive is having very simple cell wall structure here, right? So this is the difference of these two bacteria, like gram positive and gram negative here, right? Yeah. So you see, first you the what is the function of this cell wall in the bacteria? How the cell wall is protecting the bacteria? You can see there are three major functions are there. First, you see the first function of the cell wall of the bacteria is uh, to provide a semi-permeable barrier interfering with the environment through which know that the cell wall, it is acting as a, okay, it is acting as a semi permeable membrane. So what is mean by semi permeable membrane here? We know that semi permeable membrane, semi means the half only, right? Not the 100%, it is 50%, like half. Permeable means permits. Generally this cell wall, it permits only a what is that, a selected, right? The selected nutrients or the materials uh, through that particular cell wall here, right? So the harmful, right? The any material or any other things which is harmful to the bacteria, it can be prevented by the cell wall, right? It can be stopped by the cell wall here. So in this case, it is acting as a semi-permeable membrane here, right? So it allows only a few kind of materials and only few kind of nutrients here, right? That is the major function of the cell wall here in the bacteria. And the second function is to provide a sufficient strong barrier so that the bacterial cell wall protected from the changes in the osmotic pressure of its environment. Okay, so due to having this cell wall here, so it protects from the climatal change here, right? So due to having the cell wall, it means it is having the resistance of that climatal change. For example, like we have different seasons like winter, summer, winter, and rainy. Okay, so these are different seasons here. So here all these conditions, okay, winter's condition, and what is that, rainy condition or the summer condition, whatever, right? So then the temperature changes, okay. So all these changes will be monitored by the cell wall, okay. So it can be monitor all these conditions here, right? So this is also one of the function of the cell wall here. And to prevent digestion by host enzymes here. So in the metabolic process, right? So in the living organism, we have the idea that means so many metabolic processes are going to take place in the body here. Means metabolism means so many process like digestion process or the circulation process, digestion process, excretion process, right? So all these are the metabolic process here. So in all these metabolic process, what is happening here? So changes means the material, whatever the material which we are going to take, they are going to modify. It's in some reactions, the smaller molecules is going to become the larger here. And in some reactions where you can see the uh, right, so larger molecule is going to break down and it becomes smaller. So that is a like anabolism and catabolism, collectively known as a metabolism, right? So many metabolic processes are going to take place in the body. So in all these to carry out all these metabolic process, okay, to carry out all these metabolic process, they will takes place in the presence of enzymes, because all these reactions are the biochemical reactions only, right? So all these are the in vivo reaction, not in vitro reaction. We have two types of reactions, like in vivo and in vitro reactions, isn't it? So in the in vivo reaction means which is takes place inside the body. So inside the body you cannot add the any chemicals, you cannot provide any reagents, or you cannot provide any catalyst in the body. So but the reactions will be takes place, like oxidation, reduction, and substitution. All the reactions will be takes place, rearrangement also, right? Without adding any chemicals or without adding any reagent, all the reactions will be takes place, right? So here, how the reaction is taking place in this inside the body, like the reactions are takes place in the presence of the enzymes, because the enzymes acts as a biocatalyst here, right? Enzymes acts as a biocatalyst. So all the reactions will be takes place in the presence of uh, biocatalyst called the enzymes here. Okay. So sometimes what will happen here, the that particular enzymes, right? The host enzyme, right? Host enzyme, it may going to digest, right? It may going to digest by the what is that particular bacteria here, right? So the cell wall will be protected from the it will, cell wall will be prevents or the protected by digestion of the host enzymes here, right? So these are the main functions of the cell walls bacteria. Okay. And yeah, you see here already I told you that there are two types of bacteria are there, like gram positive and gram negative bacteria, and how they gram positive and gram negative bacteria are going to differ. You can see the structural features of the gram positive and gram negative bacteria here, right? Structurally they will differ. So how they are differing, you can see. First we'll take the gram positive bacteria here. Okay, so if you take the gram positive bacteria, generally we have the gram positive bacteria cell wall structure is given here. You can see the picture here, right? You can see means the composition, right? The cell wall composition is 80% is similar with the gram negative bacteria, but gram negative bacteria is having some different structure. Okay, and you see the structure of this one, very simple cell wall structure is there. And what will have means what is having these gram positive bacteria cell wall here, generally it is having poric channel here, right? And phospholipids bilayer is there. Generally the what is the cell wall is made up of the lipid layer. It is a lipid layer, like we have the lipid layer structure, like fluid mosaic structure. Okay, so bilayer is there, that is phospholipids here, and penicillin binding protein is there, right? Inside, you can see the penicillin binding protein here, and peptidoglycan layer also there, and teichoic acid is there. Okay, and so these are the some composition of these gram positive bacteria here, right? And if you see the gram negative bacteria structure, are more complex, right? So in the gram positive bacteria, you can see means outside inside is structure is complex and outside is simpler. There is no phospholipid layer in the outside here. But in the gram negative bacteria, you can see the composition of the lipid bilayer inside and outside, right? So due to this, it is acquiring the complexity, right? So the gram negative bacteria is having the what is that? A phospholipid bilayer, right? Phospholipid bilayer outside and inside here. Okay, you can see the structure of these gram-negative bacteria, and it is having some beta lactamase, right? Beta lactamase enzyme also there, and here the penicillin binding protein, so which is also having a gram-positive bacteria also. Okay, and porous channel, so you can see in the gram-positive bacteria also. So means some means few of the means features are same, and only thing is it is having the means 90%. Okay, 90% phospholipid is present in the gram negative bacteria. So due to having this 90% this is acquiring the complexity to this particular, right? So to this particular gram negative bacteria here, right? So this is a difference. So that's why you see very efficient drugs must be used to kill the gram negative bacteria, and the medium efficient drugs is required to kill the gram positive bacteria here, right? Okay. Next, the beta lactam is antibiotics here. Beta lactam antibiotics. So beta lactam antibiotics generally in this particular beta lactam antibiotics, the main example, important example is penicillins here, right? The penicillin. So the penicillin is having the beta lactam ring, right? Beta lactam ring. So the antibiotics which are having the beta lactam ring, uh, they known as the beta lactam antibiotics, right? So very important drug in this particular category is what is that, penicillin, right? Where it is having the beta lactam azitidine ring is there. Okay, yeah. So we know the history of the penicillin, right? So everybody will know the history of the penicillin, how the penicillin is invented, right? How the penicillin is invented and who is invented the penicillin. We know the story of this particular invention of the penicillin. So generally we know that the penicillin is the best example for the serendipity of the drug. So what is mean by serendipity of drug here? So serendipity of drug means the unexpectedly, right? The unexpectedly invention of the drug. Okay, so unexpectedly invention of the drug is called the serendipity of drug. So how the drug is invented unexpectedly generally. So for example, okay, right? So means the drug is invented without lead, right? So for the in the drug discovery, we have various steps. Okay, in the drug discovery, we have various steps. First, you have to choose a drug target here. Okay, the very first step in the drug chemistry means drug invention is drug choosing the drug target. Okay, then means developing the lead compound here. Okay, and the modification of the lead compound, and what is that, QSR studies and SR studies, then clinical trials and approval of the drugs and the marketing. So these are the various steps in the drug chemistry, right? So these are the sequence of the drug chemistry here, right? So means to invent a drug, you need to first you identify the lead compound here. So what is mean by lead here? The lead nothing but the smallest active compound, right? The smallest active compound is called a lead compound. Okay, so you see, in case of penicillin, there is no uh, means there is no lead compound here. And there is no means all the phases, all the steps are followed in case of penicillin here, right? So without lead, the drug is invented. In the penicillin, without lead, the drug is invented. That is in unexpectedly the drug means penicillin is invented. That's why it is the best example for the serendipity of the drug here, right? So how the penicillin is invented of the penicillin is invented without lead compound. So you know the history of that one. Generally, Alexander Fleming, right? So he's a microbiologist. We know that, right? So Alexander Fleming is a famous scientist. But he's not a chemist here. Generally, he's a microbiologist here, and means he means he want to develop a culture, bacterial culture, right? So he is going to develop a bacterial culture in the lab. He was developed a bacterial culture, and he kept that particular petri dish. Generally, they develop the bacterial culture in the petri dish here. Means biology people will know microbiologist will know the terminology, this petri dish and culture and all these things. Okay. So generally, in 1929, right, in the 1929, he was willing to develop a bacterial culture, and he provided all the facilities to grow healthy grown up that particular what is that bacteria here, right? And he kept that particular petri or the culture means cultural operators outside means he kept aside here, and he forgot about that, and he busy with other work here, right? After few days, after few months or the days or the months, right? So he remembered that, and he when he was see the particular culture plate, right? He observed some fungus formation in the middle of the particular, right, in the middle of the particular plate here, and he observed that the means leaving the middle of that particular plate, right? So the outside means remaining all place, he observed the growth of the bacteria, and there is no growth of the bacteria in the middle of the plate here, and he observed the formation of the fungus in the middle of the plate, right? Then he thought that that particular fungus, it may having some pharmacological activity, or it may having the drug property which kills that particular bacteria, or which prevents the formation, means growth of the bacteria, right? So in this way he was reported that, right, he was invented the penicillin, uh, okay, accidentally, right? There is no scientific what is that, there is no scientific what is that proof for that one. Just he assumed, right? And he what is that, he proposed that particular thing here. Then after that some other scientists like Chain, Flory, and Hatley, in 1941 they were prepared the penicillin in the lab, right? The actual penicillin is synthesized by these three scientists here, and the active penicillin is came into the use in the market here. So that is a history of the penicillin here. Next, classical preparation of the penicillins. So generally, the penicillin is having various types here, right? The main core structure, right? The main core structure of this penicillin is, it is having the beta lactam ring here, right? Generally, we know, we call this is the pharmacophore. Okay, the pharmacophore. What is the pharmacophore here? So in the drug, we have two parts. In the drug, we have two parts: pharmacophore part and non-pharmacophore part. So what is pharmacophore part here, and what is non-pharmacophore part? So here, the pharmacophore part, nothing but which is having the pharmacological activity, right? The pharmacophore part, nothing but which is having the pharmacological activity, and non-pharmacophore part. What is non-pharmacophore part here? Which is not having the pharmacological activity, but it is essential, right? Both are essential only. Both are required only. Pharmacophore part and non-pharmacophore part, both are required to show the means to show the drug property here to act as a drug, but the pharmacophore part is having the drug properties here, right? Drug activity, and non-pharmacophore part is used to bind with the protein structure or the enzymes here, right? So we know that what is the main principle of the drug chemistry here? The drug chemistry principle is a drug receptor interaction, isn't it? The drug receptor interaction. Okay, so where the yeah, right. So here in the drug chemistry, right? So when here the, for example, here is a, you see this is the receptor. Okay, so this is the receptor and this is your drug compound, right? So this is drug and this is your receptor. Okay, this is your receptor. So when this drug compound, right? So, it may be drug or the nasal neurotransmitter. So what is nasal neurotransmitter? So general nasal neurotransmitter, it is existing one. Naturally, it is occurring, right? The what is that? Endogenous chemical, right? It is endogenous chemical which is already present in the living cell here, right? So sometimes the drug are the nasal neurotransmitter. So it is going to bind with the receptor here. When this drug or the nasal neurotransmitter is going to occupy this receptor active site, okay, going to it is bind to this particular receptor active site. Then the pharmacology means then some biological, right, action will be takes place. Okay, some biological, that is called a signaling, right? The biological signal will be passed out here, and that signal will be operates that particular pharmacological action here, right? So that is the principle of the drug chemistry, right? Yeah, right. So here this, yeah, you see in this to bind with this receptor active site, the non-pharmacophore part is required, right? So the non-pharmacophore part is required to bind with the receptor active site here, and the pharmacophore part is going to show the pharmacological activity. Okay, so you see here the beta lactam is a pharmacophore part in the penicillin, and okay, so you see the this particular penicillin, it is having the what is it? Yeah, thiazolidine ring, right? You see the thiazolidine ring. Thia as a olidine means you see the having the thiazole, thiazole, because this is the nitrogen and sulfur and 5-membered ring, right? In the heterocyclic compound, you have the nomenclature of the heterocyclic compound, how to nomenclate the 5-membered ring, 6-membered ring, and with nitrogen, without nitrogen, when the two heteroatoms are there. So that what is that? Hence, nomenclature system is there. Okay, like that means according that heterocyclic compound nomenclature. So this is a thiazolidine ring is there, right? So thiazolidine ring and beta lactam ring, right? So it is a bicyclic structure is you can see, and it is this bicyclic structure is called the 6 amino penicillic acid, right? This is 6 amino penicillic acid because it is having the acid group here. You can see the acid group here where the means away to the plane here, and it this 6 amino penicillic acid 6 APA, it is having the acyl side chain, right? You can see the acyl side chain with the R substitution here, right? So with variation of the different R groups here, right? So with variation of the difference of the R groups, you can have the different names for the penicillin. For example, if the R is okay, benzyl group, If the R is benzyl group, so it becomes penicillin G, or the benzyl penicillin. And if it is R is a yeah, methoxybenzene, then it is phenoxymethylbenzene, sorry, penicillin, phenoxymethyl penicillin, or the penicillin 5. Okay, when the R is a benzyl group, so you can see say it is a penicillin G, and if it is phenoxymethyl group, then it becomes penicillin 5 here. Okay, so this is the different types of penicillins here. Right? Yeah, and if you see the structure of the penicillins, generally the penicillin is having the book shape structure, like hydrogen peroxide, right? You recall the your plus two knowledge, where the hydrogen peroxide H2O2, it is having the open book structure, isn't it? If you see the geometry or the shape of the hydrogen peroxide, you can see the open book structure like that. This is also penicillin also having the open book structure, right? So book shape of the penicillin. Next, the mechanism action of penicillin. How the penicillin is acting as a antibacterial agent, right? So, and what are the steps involved in this particular uh, penicillin drug activity? Pharmaco means are the mechanism action of the penicillin. You can see, right? So there are three steps are involved in the particular penicillin drug activity, right? So first is a synthesis of precursor with starting material here, and synthesis of peptidoglycan and cross linkage of the peptidoglycan. These are the three crucial steps, right? These are three crucial steps in the biosynthesis of bacterial cell wall, right? Biosynthesis of bacterial cell wall here. You see the what are the precursors? What is mean by precursor here? The smallest molecule, right? The smallest molecule which are used to, or you can say precursor nothing but the starting material. Simply, you can say it is a starting material here. Precursor is a starting material. So the precursor for the cell wall preparation is these two things, norm and nog, right? Norm and nog are the precursors or the starting material for the cell wall preparation. What is norm and what is nog? Norm nothing but here the N-acetyl glucosamine, right? And this is the N-acetyl glucosamine and N-acetyl muramic acid, norm and nog. These are the two precursors for the cell wall preparation here. And how this peptidoglycan chain synthesis is takes place, you can see, right? The second step is going to it is a synthesis of peptidoglycan, right? So by cross linkage of these, right? So by combination of the knob and nog, right? N-acetyl muramic acid, okay, N-acetyl muramic acid and N-acetyl glucosamine, NAG and NOM here. So by peptide formation, you can see the formation of the peptidoglycan chain. It is a giant structure, a protein. It is nothing but your protein only, right? So you can see the formation of the peptidoglycan chain, right? And by cross linkage of all these peptidoglycan chain, the cell wall preparation will be takes place, right? Here you see how the peptidoglycan chain is elongated, right? How the peptidoglycan chain is elongated. You see here, yeah, right? So here you see this is a glycine, right? So this glycine is going to cross link with here, right? A glycine is cross link with this D-alanine here, where it is the D-alanine is going to leave. And what is happening here? The cyclized product here, right? Linkage. The cyclized product is going to form, because here is a acyclic only, and here is a glycine. Again, uh, the middle center chain also, it is going to combine with this alanine, D-alanine here. Then what is happening here? The formation of this chain, right? Polypeptide. Polypeptide simply called as a peptidoglycan, right? this peptidoglycan chain is going to form here. Okay. So next, the third method is a cross linkage of the peptidoglycan, right? The cross linkage here, the cross linkage, due to cross linkage, the cell wall preparation is stops there. Means the this is the final step in the cell wall preparation, cross linkage of the peptidoglycan. So how the peptidoglycan is going to cross link, and this cross linkage of the peptidoglycan takes place on the transpeptidase enzyme, right? This is a very very important enzyme which helps to cross linkage of the peptidoglycan chain, right? On the surface of, means on the surface of the transpeptidase enzyme, this cross linkage of peptidoglycan chain is takes place here, right? So the transpeptidase enzyme is a very important enzyme which helps in the cell wall formation. Okay. So how the normal process, this is normal mechanism, right? This is a normal mechanism how the cell wall formation, how the cell wall preparation is takes place in the bacteria, like either it is gram positive bacteria or the gram negative bacteria, you can take any one of these two. But in both the cases, in both the bacteria, right, in both bacteria, the cell wall preparation takes place by means of these three steps here. What are those here? The first step is a synthesis of precursor starting material here, means precursor means NAM and NOD. These starting material is going to form, synthesize. Then the synthesis of peptidoglycan by means combining of these two starting materials like precursors, NAM and NOD, they are going to form the peptidoglycan here. That is your second step. And your third step is a cross linkage of the peptidoglycan, right? And this cross linkage is taking place on the surface of your transpeptidase enzyme, isn't it? It takes place on the surface of your transpeptidase enzyme. Yeah, here the right. So here the cross linkage is takes place, and the cell wall preparation, right, is takes place here. That is a normal mechanism uh, in order to prepare the cell wall here. Okay, here how the normal mechanism it takes place. You see here, right? Yeah, right. So here this is transpeptidase enzyme, where the cross linkages takes place here, and the peptide chain is going to leave, and the means where the cell wall preparation is over. That is normal mechanism. Next, the mechanism inhibited by the penicillin, right? So in the means drug inhibition, right? So this is your normal. This is your drug mechanism where the penicillin, right? The penicillin mediated mechanism, right? So of okay, in place of what is that? Uh, yeah, right. So in place of penicillin, right? Sorry, in place of peptidoglycan chain, here the penicillin is involving in the mechanism, right? The penicillin is involving in the mechanism. So instead of here the peptidoglycan chain, here the penicillin is going to inhibit the transpeptidase enzyme, right? So we know that we have the different types of enzymes like okay, like in the okay, so enzyme inhibition, there are two types like reversible inhibition and irreversible inhibition. And in the reversible inhibition, we have three types like what is that? Competitive inhibition, okay, competitive reversible inhibition, non-competitive reversible inhibition, and uncompetitive reversible inhibition. So like that, here the competitive inhibition, this mechanism is right. This mechanism is a type of competitive reversible inhibition, right? right? So it is a competitive reversible inhibition here, right? So what will happens in the competitive reversible inhibition? So what is competitive reversible what is competitive inhibition here? So competitive inhibition nothing but where the both will be, right? The both means like nasal neurotransmitter and the drug compound, right? Endogenous chemical and exogenous chemical, right? Endogenous chemical and exogenous chemical, both is going to compete each other. Both will be compete each other here. Then you can see the a war, a competition is takes place between the uh, endogenous chemical and the exogenous chemical. What is endogenous chemical in this case here? Peptidoglycan, right? The peptidoglycan is a endogenous chemical, and the penicillin is the exogenous chemical, means the drug compound artificially prepared, which is coming from the outside here, isn't it? So both gets compete each other, but then ultimately your the penicillin is going to win in this race because the penicillin is artificially prepared, and we are okay. We prepared that artificially. We prepared the penicillin, so always it is having more efficiency. Okay, so it occupies the enzyme active site. Then what will happen here? There is no, right? There is no space to attack that particular peptidoglycan chain here. So the peptidoglycan chain formation is going to stop there because that enzyme transpeptidase enzyme active site is occupied by the penicillin. So the peptidoglycan chain is not going to take place. Peptidoglycan chain synthesis is not going to take place. So the cell wall synthesis is stops there. If the cell wall synthesis is stops there, then what will happen? There is no there is no growth of the bacteria, right? So there is no growth of the bacterial population, right? So in this way, we are stopping the bacterial growth or the bacterial population increase by inhibiting the transpeptidase enzyme with the penicillin. This is the mechanism, actual mechanism which takes place during this penicillin uh, inhibition. Okay, yeah. Next, synthesis, penicillin synthesis, very important here. So how does penicillin is going to synthesized? So very simple, where we are taking the thalidomide here. The thalidomide is a starting material. Very simple reagents are used to synthesize the penicillins here. You see the thalidomide is a starting, and thalidomide is it is condensed with the what is that? Yeah, so yeah, tertiary butanoate here, like tertiary chloro-tertiary butanoate ester, right? This particular ester is condensed with this particular thalidomide in presence of potassium hydroxide here, where you can see N substitution. You can see the formation of the N substitution. Then again, we are means we are going to treat with the butyl formate here. Okay, butyl formate in the presence of sodamide. Okay, and you can see the formation of the pharmyl group, means formylation reaction is takes place here. Then the side chain substitution here, where the thioalcohol is going to attack on this particular pharmyl group here, and we are going to get this particular what is that thiazolidine ring, right? Thiazolidine ring here. Then by treating with the diamine, right? Diamine in the presence of triethylamine and acid, where we are going to get this the intermediate compound here. Then further upon reaction of the different reagents here, right, we are going to get this particular uh, thiazolidine ring, right? 6 amino penicillic acid here, 6 APA. Then by treating with the DCCD, right? DCCD is a coupling reagent here. It is a coupling reagent. So by coupling with the DCCD, by treating with the DCCD in the presence of potassium hydroxide, where we are getting this penicillin. Okay, so and here the R substituted penicillin here, and in the in place of R, you can take the benzyl group, then you will get the penicillin G. And if you take the phenoxymethyl group, then you will get the penicillin 5 here, right? So this is the synthesis of penicillin here, and disadvantage of this penicillin, right? So generally, the penicillin is having the advantage and disadvantage, both things are there. What is the advantage here? Generally, the advantage of penicillin is it is acting as an antibacterial agent, which stops the bacterial cell wall synthesis by inhibiting the transpeptidase enzyme. That is the advantage of this one. And disadvantage is also there, where the bacteria, the penicillin, it is acid sensitive, right? It is acid sensitive, means when you take this penicillin orally, generally, means we have the various administration process here, drug administrations like oral administration, intravenous administration. Okay, so these are the various methods of the consuming the drugs here, right? The oral administration means we'll take the drug from our mouth, right? In the generally the tablets or the syrups, they are taken by the mouth here. So that is oral administration, and intravenous administration is taken in the form of the injection here, right? Where directly we will inject that particular drug, right, in the nerves, means directly it is mixed into the blood here, right? Okay. So but here the penicillin, okay, the main disadvantage of this penicillin is it is acid sensitive here, right? So generally in our body there are acids called the HCl, right? Hydrochloric acid is there. So with that particular acid, the beta lactam, sorry, right? Yeah, the beta lactamase ring is going to cleave, right? The beta lactamase ring is going to cleave with the acid here, right? You can see this particular acid reaction here, right? So you see this is the beta lactam ring here in the presence of acid H plus, right? In the presence of acid here, where this ring is, right? So this ring is going to cleave, and you can see the opening up, right? The opening of this beta lactam ring is takes place, and the deformation, right? So it is losing, if the beta, because the beta lactam ring is a pharmacophore here. This is the main key part in the penicillin, isn't it? Beta lactam ring is a key part in the penicillin. If it is, this ring is going to open, then what will happen? It is losing its pharmacological activity, right? It becomes inactive. It becomes inactive. So that is the main disadvantage of this particular penicillin here, right? It is acid sensitive. So to prevent this particular acid sensitivity, we prepared the analogs of the penicillins here. We prepared the analogs of the penicillins, right? Means what we are doing, by substituting the, right, by substituting the means electron withdrawing groups and some other bulky groups here, we are making this particular lactam ring, beta lactam ring, right, acid desensitive, right? Acid desensitive here. So what are those particular means analogs, penicillin analogs? Uh, Generally, these penicillin analogs are called the BSAB, right? BSAB means broad spectrum of antibiotics. Broad spectrum of antibiotics. Uh, Broad spectrum of antibiotics means these are the penicillin analogs here, right? Penicillin analogs. So this BSAB, it is classified into two types here. One is class 1 BSAB and class 2 BSAB. What is class 1 BSAB? What is class 2 BSAB? You can see. So what type of penicillin derivatives, the analogs, come under class 1, and what type of penicillin derivatives or the analogs comes under class 2, you can see. And what is a how, means in what bacteria it is active, in what bacteria it is inactive, and how much it is going to prevent the bacterial means bacterial what is that diseases. You can see here the first you take the class 1 semi synthetic penicillins here, right? So this, you see the 6-APA is common here, right? Where the 6 amino penicillic acid is a common, but only the R change, R group is going to change, right? We are modifying the R group here. We are introducing the various substituents in place of R here. But we are keeping this 6 amino penicillic acid constant here, right? 6 amino penicillic acid is constant here. Only just why we are introducing these bulky groups or other groups means to prevent the acid sensitivity, to reduce the acid sensitivity of the penicillin here. Okay, yeah. So in the class 1 semi-synthetic penicillins, we have here the two compounds here, like yeah. So here the COR, right? So this is the core structure, means the, right. So in place of R, right? So this is the core structure here. This is a core structure. Sorry, this is a core structure, and we are wearing the R group here, right? We are changing the R group here. So yeah. So in place of R, okay. So if you keep the benzyl methyl phenyl, okay, methyl phenyl oxazole, right? Oxazole here, then it becomes the oxacillin, right? Oxacillin. So in place of R, if you keep the chlorine, then cloxacillin, oxacillin and the cloxacillin here. And yeah, one more compound is there. So, but where you can see the uh, here is a where we are introduced the oxazole ring here, and here in place of R, we are introduced the what is that phenyl group here, right? Phenyl group, and in place of R here, where if you take the hydrogen, this is ampicillin here, and in place of R, if you take the hydroxy group, it is amoxicillin, right? So these are the analogs, semi-synthetic penicillins here. Okay, and all these oxacillin, cloxacillin are and ampicillin. So all these antibiotics these are active towards both gram positive and gram negative bacteria. Right? So these are the active against both bacteria here, right? And next, class 2 semi-synthetic penicillins. So in this particular class 2 category, generally, right? So these are uh, taken by the injection form, means intravenously convenient drugs here, where in place of R, where we are taking this particular benzene, means methyl, means what is that, phenyl, uh, phenyl acetic acid here, right? So this is a carbicillin, right? And here is where the thiophene, right? So here the thiophene ring is taken like carfacillin here, right? So carfacillin, carfacillin. So, and generally these are uh, gram negative bacteria active drugs here, right? So these are the active against the gram negative bacteria here. Okay, so the previous one, class 1 semi-synthetic penicillins are they are active against both gram negative as well as gram positive here. But class 2, these are active against the gram positive, gram negative only, right? Right. And some other derivatives also there. You can see the means ampicillin and carbicillin. So these are the where you see the active against the gram negative and some of the active against the gram positive bacteria. And you can see the features, structural features of this of oxacillin and cloxacillin. So what are the structural features here? You see where the yeah,
Sir, here
right. So
in
in the
oxacillin,
ampicillin and
sorry, sir.
amoxicillin,
Uh, uh,
oxacillin and cloxacillin.
yes, sir. In
Oxacillin,
oxacillin, sir,
where
sir, I have a
yeah.
question, sir.
So
Hello, sir.
yeah, tell me.
Sorry, in oxacillin and
Tell me,
cloxacillin,
tell me.
so they are asking that instead of R we can substitute H. Instead of R we can substitute C. Then R substitute, if you substitute R, H it will be oxacillin. If you substitute
Hmm.
Cl, it will be cloxacillin. But in this there, where is the R?
Yes, here. So it is missing actually in our
Yes.
here. It is missing.
So
Here you need
where
to
shall
keep
we
R.
write? Okay,
Here,
sir.
here. Just I kept the R now. Here.
Yes,
Here
sir.
you
Okay,
keep the
sir.
R, right?
Okay, sir.
So
Okay,
in
sir.
place of R, if you keep the hydrogen, it becomes
Yes, sir.
oxacillin.
Yes,
In
sir.
place of R, if you keep the chlorine, then it
Yes, sir.
becomes cloxacillin.
Cloxacillin.
Okay,
Thank you,
right,
sir.
right.
Sorry, sir.
Yeah, fine. Right. So, okay, fine. So in the class two semisynthetic penicillins, sorry, in the class one, like you see, one second. So here in place of R here, if you keep the hydrogen, it is ampicillin here, and you can see the configuration, right? So here the L configuration is inactive. Only D configuration is active, right? So what is L and D? So these are the relative configurations, right? So in the DL configuration, RS configuration. So this is the nomenclature, right? So like for example, in the amino acids, right? For example, here NH2 and hydrogen, right? Or like here methyl is there. So then you see you can give the nomenclature means RS configuration or the DL configuration, right? So here if the amino group is right, amino group is on the right side, then it is D. If the amino group is left side, it is L, right? So in the amino acids we'll use the DL configuration, DL nomenclature here, right? If the amino group is on the left side, so it is L configuration. If amino group is on the right side, it is D configuration, right? So like that, when you keep the what is that amino group, right? Amino group is away to the observer, then it becomes D configuration, and it is what is that pharmacologically active, right? If the R if the amino group is towards the observer, nearer to the observer, then it is L configuration, and L configuration is inactive. You don't have the pharmacological activity, right? We know the importance of the configurations here. We know the importance of the stereochemistry in the drug chemistry, because the stereochemistry plays very important role in the drug chemistry, right? So due to changing the configuration, means due to changing the configuration, it's lost its pharmacological activity. Generally you see here both L configuration and D configuration, both are isomers only, isn't it? Only thing is they are differing with the location, right? The location of the groups, the orientation of the groups only. Both are having the same molecular formula, same groups are there, same atoms are there, right? Same number of carbons are there, same number of hydrogens, oxygens, everything is same. Only thing is the orientation of the group is differs, where in the D configuration the amino group is right, the amino group is away to the observer, means it is out of plane. Out of plane means when you yeah, when you locate with the uh, right here the dotted line, right? So this is away to the observer or the out of the plane. When you denoted with the heavy line here, right? Like here, heavy line, it indicates a nearer to the observer or the towards the observer here, right? So if the NH2 group is away to the observer or the out of plane, so then its configuration will be the D. And if the NH2 group is right, NH2 group is nearer to the observer, then its configuration is L. So if it is L configuration, it is inactive, and if it is D configuration, it is active one. So the stereochemistry plays very important role in this particular drug chemistry. So anyhow, we have the chiral drugs in the next means for, next topics here. So in the chiral drugs, we'll see the what is the importance of the chirality in the drugs, in the how it plays a crucial role. Right. So in the pharmacological activity, we'll see there. Okay, fine. So like that, all these are the different penicillins, analogs. Why are prepared all the penicillin analogs? To prevent the acid sensitivity, right? Because in the normal penicillin, right, in the traditional penicillin, it is the normal penicillin is acid sensitive. So by acid, right, by reaction with the acid, the lactam ring, beta lactam ring is going to open and it becomes inactive. So to prevent this inactivity, to prevent this beta lactam ring opening or the cleavage, we are making that penicillin uh, acid inactive by substituting the different bulky groups or like so, okay. Next, beta lactamase inhibitors, right? So beta lactamase inhibitors. So here the beta lactamase inhibitor. What is beta lactamase here? So beta lactamase, it is an enzyme, right? Beta lactamase is a enzyme which is present in the bacterial cell wall. You can see the, just you recall the cell wall structure of the gram positive and gram negative bacteria. Here you can see the, sorry, right? So here is a beta lactamase, right? This is a beta lactamase in the gram negative bacteria, the gram positive bacteria. So beta lactamase enzyme is there in the cell wall, and it is present in the cell wall preparation here. So here what we are doing, we are inhibiting the beta lactamase enzyme, right? We are inhibiting the beta lactamase enzyme with the drug compounds here, right? With the drug compounds. So beta lactamase, those are called the beta lactamase inhibitors. In this particular beta lactamase inhibitors, we have two drugs here, clavonic acid and sulbactam, right? So clavonic acid and sulbactam, these are also antibiotics only, but they targets the beta lactamase enzyme, right? Where the penicillin, it is targeting the transpeptidase enzyme, isn't it? Just you see the difference, where the penicillin, it targets the transpeptidase enzyme, and it involves in the cell wall preparation, and it occupies the transpeptidase enzyme active site, and it is preventing the formation of the peptidoglycan chain, isn't it? That is the mechanism of the penicillin. And the beta lactamase enzyme, means beta lactamase enzyme inhibitors like clavonic acid and sulbactam, same mechanism will be followed, but only thing is here, in place of transpeptidase enzyme, where it is involving the beta lactamase. Okay. So here also the, you can see the similar structural similarity will be there with penicillin, but only few of the structures are different. Only thing is, you see the in the beta lactamase enzyme inhibitors like clavonic acid. First, you take the clavonic acid. So how the structure is modified? You can see here, in the penicillin. Just you recall penicillin structure, and you compare with the clavonic acid here. So what are the structures are changed? You can see the lead modification. Here the beta lactam ring is, it is there. Beta lactam ring is there in the penicillin as well as your clavonic acid. That is common for both the drugs here. And here the double bond is introduced here, isn't it? In the clavonic acid, here the double bond is introduced. You see the double bond here, right? The double bond is introduced, and here the double bond configuration is Z configuration, right? So what is Z and EZ? So here the EZ also the stereochemical nomenclature here, right? EZ configuration, geometrical isomers here, right? EZ nomenclature already you come across in your first year stereochemistry. EZ nomenclature, RS nomenclature, EZ nomenclature, DL nomenclature. So all these are the, right, the configurational means geometrical isomers here, right? So here the configuration of the double bond or the olefin is Z configuration, right? Where the E configuration is inactive, and the Z configuration is active here, right? Next, no substitution at C6 group here, right? So where is the 6 here? Okay, yeah, here, right? So in this particular, in the penicillin, right? If you see the penicillin structure here, the acyl side chain is there in the penicillin. Here the acyl side chain RCO, right? NH group is there in the penicillin, but in the clavonic acid there is no side chain here. There is no acyl amino side chain, that is removed. Next, R stereochemistry, right? The R configuration at 2 and 5 position here, right? So here the means it is a chiral compound here, where you can see the two chiral centers, right? Two stereogenic centers here. Two chiral centers are there at the fifth position and second position, right? Fifth position and second position, and in both positions you can see the R configuration, right? So how to assign the RS configuration here, where the just you means you give the numbering 1 2 3 4 numbering according their molecular weight here, isn't it? According their molecular weight you give the numbering, and for example here, right, 1 2 3 4 is there, for example, just assume, right? Then you clockwise or the anti-clockwise, right? So just you meet all the what is this numerics here, right? Meet all the numerics in chronicle order here, like 1 2 3, right? So if you get the clockwise rotation here, then it is R configuration. If you get the anti-clockwise rotation, then it is S configuration. So like that, here when you give the priority numbers here, okay, according to their molecular weight, you give the priority numbers. Uh, it is going to give the R configuration here, and here also the R configuration, means the both will be the clockwise direction is takes place here. And next change modification is generally here the carboxylic acid group is there in both cases, like penicillin and your clavonic acid here. And you can see that in this particular penicillin, where the in the apex, okay, here the apex atom is a sulfur in the penicillin, isn't it? Just what we are trying, we are comparing both the structures, means penicillin and clavonic acid. What are the modifications is done in the clavonic acid, and what are the means features are there in the penicillin? Just we are comparing both the structures here, right? So in the penicillin we have the sulfur, but in this clavonic acid we have the oxygen here, right? The sulfur is replaced by the oxygen. So these are the structural modifications of the penicillin in order to get the clavonic acid here, where it is clavonic acid is acting as a beta lactamase enzyme inhibitor, right? Now the mechanism of action, right? So mechanism of action, so same mechanism is followed, like your what is it sorry same mechanism is followed like your penicillin, right? But only thing is, there we will use a what is that transpeptidase enzyme surface, and here is it is attacking on the beta lactamase enzyme in here, surface here, right? This reaction is takes place on the surface of the beta lactamase enzyme. There it is takes place on the surface of your transpeptidase enzyme, right? But same mechanism is followed, like you see, where the inhibition of the clavonic acid with your transpeptidase, sorry, beta lactamase enzyme, right? So same mechanism is followed, where this is also going to stop the bacterial cell wall preparation, right? Yeah. Next, salbactam. This is also as what is that? So beta lactamase inhibitor, right? So salbactam also acting as your beta lactamase enzyme inhibitor, but some other modifications is done, right? You see where the like when you compare with your clavonic acid, the apex group is the apex atom is oxygen, but here the sulfoxide here, right? The SO2 group is introduced here, and here is what is it? Beta lactam ring is common in all the cases, right?
సార్ ఏం వినపడతలేదు సార్.
नागराज भाई, हेलो.
Yep. Okay, right. So here the sulbactam and right? So here the sulbactam and clavonic acid. So these are the beta lactamase inhibitors here, right? And one more beta lactamase inhibitor is there, that is a cephalosporin here, and some modifications is done uh, in order to enhance activity of the this particular means antibacterial activity. So generally we modified the lead structure and we bring these particular cephalosporins, and how the modification is done, what are the structural features of this cephalosporins, and then we'll discuss in the next class here. So I'm stopping here. Okay, I'm stopping here.
Okay, thank you, sir.
శమన నమస్తే. మూర్తి సార్ నమస్తే.
నమస్తే నమస్తే. బాగున్నారా?
బాగున్నా. ఎక్కడున్నారండి? యుఎస్ లోనే ఉన్నారా, ఇండియాకి వచ్చారా?
వచ్చేసాను ఇండియా.
ఓకే ఓకే, వచ్చేస్తే నో ప్రాబ్లం. శ్యామన్ ఎక్కడ పెట్టిపోయిండు?
ఎక్కడ సార్?
శ్యామ్ సార్ కూడా ఉన్నాడు కదా, ఆయన
శ్యామ్ సార్ కూడా
ఫోన్
వచ్చాడు.
పెట్టకుండా
బాగానే వచ్చారు సార్. నిన్న ఎవరు రాలేదు క్లాస్ కి.
నిన్న కూడా జరిగిందా సార్?
నేను క్లాస్ జరిగింది సార్, సెకండ్ సాటర్డే జరిగిందంట కదా.
అక్కడికి వెళ్ళి కాదు యూనివర్సిటీకి.
ఆఫ్లైన్ క్లాస్ నేను ఒక్కడే పోయినా.
ఓకే, ఆఫ్లైన్ అంటే ఎవరు పోతారులే సార్.
సార్ కలుద్దాం ఎప్పుడైనా.
సరే సార్.
ఎక్కడుంటారు?
నేను ఇప్పుడు హైదరాబాద్ లో ఉంటున్నాను సార్.
ఎక్కడ సార్ ప్లేస్ చెప్పండి, కలుస్తాము.
తార్నాక.
అబ్బా, నేను గచ్చిపోలి.
ఓకే, ఇంకా అదొక
అదొక
ఇండియా
ఎండ్,
పాకిస్తాన్
ఇదొక
అలా
ఎండ్.
ఉండదు.
అవును.
నెక్స్ట్ క్లాస్ ఏంటి సార్?
నెక్స్ట్ క్లాస్ సార్ చెప్తారేమో, కోటేశ్వరరావు సార్.
ఓకే.
పెరిసైక్లిక్ రియాక్షన్స్ అని ఏదో పెట్టారు.
ఓకే ఓకే. ఇది ఆల్మోస్ట్ ఈ మొత్తం ఒక యూనిట్ అంతా కంప్లీట్ చేసిండు ఈరోజు.
అవును, చాలా ఇంపార్టెంట్ కూడా కదా.
కాకపోతే అవన్నీ గుర్తుపెట్టుకోవాలి సార్, స్ట్రక్చర్స్ అని కష్టం అవుతుంది.
చాలా కష్టం. పెన్సిలిన్ గుర్తుపెట్టుకోవడమే కష్టం అనుకుంటే ఇంకా 3 స్ట్రక్చర్స్ యాడ్ చేశారు.
అవన్నీ గుర్తుపెట్టుకోవాలంటే కష్టం.
హలో,
చెప్పండి
సార్. సెకండ్ సాటర్డే వెళ్ళిన క్లాస్ ఏం చెప్పారు? కోటేశ్వర
నమస్తే అక్క గారు, మీకు పాదాభివందనం.
నాగరాజా మాట్లాడింది ఇప్పుడు?
అక్క గారికి పాదాభివందనం అంటే ఎవరంటారు చెప్పు కాలేజీలో?
అదే నేను అనుకున్నాను, మా తమ్ముడే మాట్లాడుతున్నాడు అనిపిస్తుంది. మళ్ళీ డౌట్ వచ్చింది.
బిస్కెట్ ఎట్టేస్తుందో చూడండి సార్, ఇంత పెద్దల ముందల.
బిస్కెట్ కాదు, నేను ఏదో వర్క్ లో ఉన్నానబ్బా.
మీరు ఎప్పుడు వర్క్ లోనే ఉంటారు తల్లి, మీరు ఖాళీగా ఎప్పుడు ఉంటారు చెప్పు?
ఆ కోర్స్ కూడా అయిపోతుంది, జాయిన్ అవుతా అన్నావు కదా.
నేనేడ కాదులే తల్లి, నాకు బొచ్చుడు ఉండే పనులు ఇప్పుడు.
మొత్తానికి ఫస్ట్ ఇయర్ నువ్వే అంట కదా, ఫస్ట్ వచ్చింది కాలేజ్ ఫస్ట్.
నువ్వు ఫస్ట్ వచ్చిన అంటారా తల్లి?
కాదు, ఎక్కడున్నా?
ఇప్పుడు హైదరాబాద్కి వచ్చా.
మొన్న ఒకసారి ఆఫ్లైన్ కి వచ్చాము, ఆ రోజు ఎవరు రాలేదు, ఒక 2-3 వచ్చారు అంతే.
ఓకే ఓకే.
ఏది ఆ సారు సెకండ్ సార్ట్ ఏం చెప్పారో తెలియదే మనకి. ఇప్పుడు మాట్లాడారు.
ఒక్క రోజు మిస్ అయితే ఏం కాదమ్మా, పాస్ అవుతావు.
అయ్యయ్యో, ఒక్కరోజు మిస్ అవుతేనే మనం మార్కులు పోగొట్టుకుంటున్నామే.
ఏమైతుంది ఇంకేం మార్కులు తల్లి, ఇంకంతా సార్ ఏమో పెద్ద జాబ్ చేస్తుండు.
అట్లానేం లేదు, మొత్తము ఏదో ఫుల్ ఫ్లెడ్జ్డ్ గా మహా అయితే ఒక 5 నెలలు చదువుతాం కదా. ఇంకా ఏమన్నా రాస్తున్నావు గవర్నమెంట్ జాబ్స్?
వాళ్ళు ఉద్యోగాలు వేస్తే కదా తల్లి రాసేది.
ప్రిపేర్ అవ్వాలని మొత్తం ఏదో ఒకటి గవర్నమెంట్ జాబ్
కొట్టేస్తావాక.
నేను ఎవరిదాలు వస్తే అందరికి పార్టీ ఇస్తాను, మన ఏమంటారు మన యూనివర్సిటీలో అందరికి.
ఏమవుద్దు పార్టీ ఏమవుద్దు కానీ నువ్వు కొట్టేస్తావు.
మా తమ్ముడు బ్లెస్సింగ్స్ ఎప్పుడు ఉండాలని కోరుకుంటున్నాను.
చిన్నోళ్ళు ఏం బ్లెస్సింగ్ ఇస్తారక్క?
కాదు, ఎప్పుడో అందరూ యూనివర్సిటీ దగ్గర కలుద్దాం ఎప్పుడు అనేది ఒక ప్లాన్ చేయండి.
యూనివర్సిటీకి పోయి ఏం చేయాలి?
ఇప్పుడు కదా ఆన్లైన్ క్లాసెస్ అయిపోయిన తర్వాత ఒకసారి అందరు గ్యాదర్
ప్రాక్టికల్స్ వస్తాం కదా,
అప్పుడు సీరియస్ గా వర్క్ లోనే ఉంటారు కదా.
అప్పుడు కాలుగుండా ఏం చేయాలి మరి?
మొత్తానికి ఇప్పుడు ఏం ప్రిపేర్ అవుతున్నా మరి?
ఏం లేదు తల్లి, వచ్చి నిన్ననే వచ్చిన హైదరాబాద్ కు.
అవునా?
నాకు బిఎడ్ ఇంటర్న్షిప్ స్టార్ట్ అయింది.
అవునా? మరి ఎట్లా ఇది అవ చేసుకుని వెళ్ళిపోతావా మళ్ళీ?
ఇంటర్న్షిప్ ఏమో ఈ 1 month ఉంటుందో 15 days ఉంటుందో తెలియదు. అది అయిపోయినాక మళ్ళీ వెళ్ళి మళ్ళీ వస్తా, జూన్ జూలైలో వస్తా.
ఓకే ఓకే.
మళ్ళీ ఎగ్జామ్స్ ఉంటే వస్తా బిఎడ్ మన పీజీకి.
అదే ఒకసారి అయిపోయాక అందరం కలుద్దాం మరి.
వస్తారు కదా ప్రాక్టికల్స్కి? వస్తారులే.
వస్తాము.
నేను కూడా వస్తా అక్క.
మొత్తానికి సెకండ్ ఇయర్ సక్సెస్ఫుల్ కంప్లీట్ చేస్తాను అనమాట అయితే.
ఇక కంప్లీట్. అరే నేను అన్ని రోజులు వచ్చినా నాకు 38-35 మార్కులు వేసాను ప్రాక్టికల్.
మరి మాకు తక్కువే వచ్చినాయి, మేము పేపర్స్ అన్ని పర్ఫెక్ట్ గా రాసాము.
అరే నాకు ప్రాక్టికల్ తక్కువ వేసారు తల్లి.
అవును, చాలా మందికి ప్రాక్టికల్స్ తక్కువే వేస్తారు.
35-37 వేసారు, అంతగానం చేస్తే కూడా.
చాలా మందికి తక్కువే వచ్చినాయి అంట మరి.
అట్లా ఉండనిలే, పాస్ అయితే దాంతో ఏం చేస్తాం మార్కులు.
కానీ అంతేలే. అయితే యూనివర్సిటీలో అందరం కలుద్దాం ప్రాక్టికల్స్ కి.
సరే తల్లి, నెక్స్ట్ క్లాస్ కి అటెండ్ అయిదాం. మళ్ళీ అందులోకి రండి, ఇంకో లాగిన్ లోకి రండి.
ఎన్నింటికి?
ఇప్పుడే తల్లి 12 o'clock అనుకుంటా.
ఓకే ఎంజాయ్.
ఓకే సరే. ఈ శ్యామన్ ఎక్కడ పోయిండో తెలుస్తలేడు.
ఎక్కడికి ఉంటాడు, ఎక్కడ చూడు.
ఫోన్ పెట్టి ఎక్కడో పోయిండు ఆయన. అది ఏంది లాగిన్ 10:30 to 12 అన్నాడు. నెక్స్ట్ క్లాస్ వచ్చేసి 3 to 4:30.
నెక్స్ట్ 3 to 4:30.
నో 12 to 1:30 పెరిసైక్లిక్ రియాక్షన్స్.
ఏది మన కోటేశ్వర సార్ అనుకుంటా.
కోర్స్ 5.
కోర్స్ 5
కోర్స్ 5 మెకానిజం పెరిసైక్లిక్ రియాక్షన్స్.
అంతేలే, ముందు యూనిట్స్ తెలిస్తే తర్వాత చాప్టర్ చదవచ్చు.
వాడు వేసిండు